Hello. So today I'm going to be discussing polypharmacy in the elderly. So older patients with polypharmacy have become the norm rather than the exception in general practice. Drug use for the elderly has been increasing annually. The majority of the elderly use on average 7 medications. Elio Lopez, our textbook author, defines polypharmacy as a patient using 5 or more medications, which definitely puts most elderly in that category. Due to drug-to-drug interaction, polypharmacy raises the adverse effects for many patients. Medications serve many purposes and benefits in treating their specific conditions. However, it also poses risks of medication-related harm and safety risks to patients. According to Rankin in 2018, a medication-related problem is described as an event or circumstance involving a patient's drug treatment that actually or potentially interferes with the achievement of optimal outcome. There are solutions in aiding patients that are at polypharmacy risk or to decrease the amount of medications that are prescribed. So for starters, computerized decisions support, which is also known as the CDS, is aimed at prescribers whereby electronic alerts are produced to guide the prescriber to the right treatment. And this has shown to be successful in reducing inappropriate prescribing for older people. Another tool is called Prima Ed's tool, which is it's an acronym. So it's polypharmacy, reduction of inappropriate medication and adverse drug events in an older population by electronic decision support, is a comprehensive electronic decision support tool to assist physicians in treating their older patients with polypharmacy. It consists of 2 parts: a data entry to fill in up-to-date patient data, and a comprehensive medication review to support physician and patients in reducing potentially inappropriate and non-evidence-based polypharmacy in a shared decision-making process. Lastly, pharmacist-led interventions such as medication review, coordinated transition from hospitals to long-term care facilities, and pharmacist consultations with patients and physicians have been shown to effectively reduce inappropriate prescribing and adverse effects on patients. I chose to discuss polypharmacy because our elderly are vulnerable, and it will take a collaborative and consistent effort to improve their overall drug treatment and reduce their risks of polypharmacy, or even reduce the amount of medications that are being prescribed to the elderly population. So again, thank you for listening.